closer because there's some tiny things I'm going to point to. The far left of this model is equivalent to this one here on the stand. This model gives us less detail about the kidneys themselves, but it gives us a good depiction of the drainage from the kidney down to the bladder. So good internal anatomy on the bladder. And then in particular, this is a male model, and you see accessory glands at the back and bottom of the bladder that are part of the accessory glandular system in the male. Okay, so they'll be part of the reproductive genitalia and reproductive model list on your unit treatment paper. Okay, prostate, seminal vesicles, and end of the vas deferens. All right, we'll talk about that when we get there. All right, so let's start here looking at the kidney and longitudinal section. Two obvious zones, just like you saw on your cat. This lighter colored outer cortex and this darker colored inner medulla. The inner medulla is made up of these pyramidal little structures here called pyramids, conical structures called pyramids. On this model right here, they have a texture that almost makes them look like a mum. But it's thready and striated, and you can see that here on this flat model too. And it's thready because of what's happening in the pyramid. The pyramid contains the tubules of the collection system, and they are long and tubular, and so they give this kind of this thready longitudinal grain to the pyramid. Here's one pyramid right here. Normally there are 8 to 9 pyramids making up or found within the kidney, roughly. There's a lot of variation. These pyramids are going to need to be drained. And so here, when you're looking at this one up close, you're looking at this bump at the bottom, or this bottommost portion of this one pyramid. These pores are in the papilla. This is called the papilla. And here's a funnel cupping it to catch the filtrate that's going to lead through those pores. So this funnel is called a calyx, singular, calyces, plural, and it's the minor one, it's the smaller one. There's a minor calyx cupping the bottom of each pyramid. So here's a minor calyx, here's a minor calyx, same comment, same comment, same comment. They are all going to converge onto a greater area of funneling this fluid, the major calyx, and then the major calyces will converge on this portion of the drainage system called the pelvis, the renal pelvis. And the renal pelvis is now evident from the outside of the kidney and the outside of the kidney here. That's the renal pelvis. As it tapers and travels vertically and becomes tubular, then we will call it the ureter. Right, so 2 ureters, only one on this model in particular, 2 ureters leading from the renal pelvis, and those ureters come all the way down to the bladder, and they attach at the back, posterior surface of the bladder and toward the bottom, so that the bladder fills from the bottom up. There's an important landmark on this model right here. There's the pubic symphysis. So this is the front of the body. There's the bladder. It's kind of angled anteriorly, and here we have the back where it's receiving filtrate from the kidneys. Once the bladder fills, it's going to have to drain, and then it's going to drain through the tube that we call the urethra. So not the ureter, but the urethra. And in this male model, we're seeing the beginning of the urethra right here. But there's a gland around it. It's the prostate gland. So they give this tiny little stretch of urethra a special name. It's called the prostatic urethra because it's passing through the prostate. If this were the urethra, the prostate wraps around it like that. And so the health of the prostate can impact ejaculation and passage of urine, because if it becomes enlarged, then it's constricting on the urethra and the bladder can't drain. And as well, ejaculate can't lead through that urethra, because that is being contributed, that is reaching the urethra from the vas deferens, coming from the spermatic cord that came from the testes. we're receiving also contribution from these seminal vesicles and the prostate gland, glandular contributions. All of those glandular contributions are entering into the urethra through these pores right here. So if this area is constricted, then those glandular secretions aren't making it to where they need to go, the urine can't make it out as it needs to, the ejaculate can't be ejected as it needs to be, sexual dysfunction associated with that, and all kinds of other problems. Urinary retention difficulties. Okay. If you're looking inside the bladder, you can see the wall of the bladder. The smooth muscle that makes up the wall of the bladder is called the detrusor muscle. It's not on your list. And then there's this area at the very bottom that's roughly triangular, and it has more of a longitudinal grain to it. That helps the urine to leave from the bladder more smoothly. And it's triangular, it's called the trigone, or trigone. And the points on that triangle are defined as where the urethra meets at the bottom of the bladder and the 2 ports of entry for each ureter. So the top of the trigone, top 2 points are where the ureters are entering into the bladder at the bottom of the back, and then that 3rd point of the triangle is the beginning of the urethra, where the bladder starts to drain. Okay. Make sure you take a look at this model. It's good for male repro and excretory system. Alrighty, so that takes us through the kidney. This is your adrenal gland sitting right on top. There is the medulla of the adrenal gland and the cortex of the adrenal gland, and we talked about hormones. Cortical hormones coming from this part, epinephrine, adrenaline coming from this portion. Okay, if we go to the middle then and we look at one pyramid up close, what do we have? We see those loops of Henle reaching down into the pyramid. We also see a curtain, if you will, a capillary curtain called the vasa recta. The vasa recta. The things that we reclaim from these tubes and we put back into the circulation, we put those things back into the circulation right here at the vasa. So we dump them into these blood vessels, and that's how they get back into the body. Okay? You've got 2 kinds of nephrons here. If your nephron is close to the pyramid, it's called a juxtamedullary nephron, close to the medulla. Juxta meaning close, medullary meaning the medulla, which is made up of the pyramids. So this is close to the pyramid, so this is a juxtamedullary nephron. Long loop of Henle. The other type are cortical nephrons. They're up high in the cortex, short loop of Henle. Okay? Short loop of Henle. Here is the tubule system that we described in green on the whiteboard. Here is one renal corpuscle. Here's another, here's another, here's another, here's another. I can't call just this little part of it the nephron. It's the renal corpuscle and all of the associated tubing that makes up one nephron. So, if we're pointing to this portion of it, the renal corpuscle, now we can go to the far right-hand part of this model and look at the renal corpuscle up close. Here is the vessel bringing blood into the corpuscle. Afferent, bigger, per the whiteboard. Here's the vessel leaving the corpuscle. Efferent, exit, smaller, per the whiteboard. Blood's coming into this capillary knot, this tightly bound web of capillaries here. Remember, by definition, a capillary is one simple squamous cell thick. That's not super strong. And that means that in this capsule where I described to you filtration is taking place, and that's a pressure-driven process, you are at risk for blowing up the walls of the capillary. So, and destroying them permanently. So we have these special cells around the outside of the capillary called podocytes. And they have these finger-like extensions that come together. We call that interdigitating. And they interdigitate to support the capillary wall so that it doesn't explode. And there's a little separation between these fingers so that what's filtered can leave. Alrighty, so the podocytes are supporting the capillary wall, and then the filtrate is leaving via these crevices between adjacent podocytes. It's collecting, as it's created, in all this negative space right in here. So if I had a cup of water and I poured it in there, you'd see where the filtrate is accumulating as it's made. And then this is going to get full and is going to leave. Remember, the part that's catching it is the capsule, so my hands are on the capsule. The capillary ball knot is the glomerulus. The capsule and the glomerulus together, per the whiteboard, are your renal corpuscle. Once that filtrate's made, it's going to start to drain through the collecting duct system, and this first stretch is called the proximal convoluted tubule, PCT. It's proximal to the corpuscle. So they've shown us a little stretch of it here, and then that's where the conversation stops with this particular model. But they do show us something funny up here. What is this? It's this lime green color, and it looks important. It is. This is a little representative portion of the distal convoluted tubule. By the time the filtrate is here, it's been pretty fine-tuned. I mean, it's passed through the loop of Henle and the proximal tubule and a portion of the distal before we get to this end of it. And so if we monitor the filtrate here, we can get a pretty good indication of how things are going in the kidney. There is a sensory structure here that does that. It's another juxta term. It's called the juxtaglomerular, close to the glomerulus, the juxtaglomerular apparatus. It is a sensory apparatus right here that consists of 3 cell types. Chemoreceptor cells adjacent to the lumen of the distal convoluted tubule. They sense the chemistry, the chemicals rushing past them in the filtrate. Smooth muscle cells around the afferent arteriole coming into the glomerulus, and then there are some little cells in between that help the two communicate with one another. Where this DCT touches that afferent vessel and these 3 cells are working in a coordinated fashion, that's called the juxtaglomerular apparatus, where they physically touch. Okay. So if I wanted to represent that on a practical, I would put a piece of tape over these 2, indicating to you that they're in contact with one another. It's physical contact. What is that for? Well, depending on, and you'll look at this more in physiology, depending on the content of the filtrate, the soluble things that we're finding in the filtrate by the time we're in the distal convoluted tubule, we might want to slow down filtration or speed it up. If, back to the whiteboard in blue, if we constrict this vessel with these smooth muscle cells, then we decrease the volume of blood moving into this space, yes? In the blue box, if we decrease volume, what does that do to pressure of any kind? Decreases pressure. If we decrease pressure here, since filtration is pressure driven, we decrease the filtration rate. If we decrease the rate of filtration, we decrease the creation of filtrate. Urine production slows down. Opposite, if based on what we see here, we think we need to speed up filtration, then we dilate this vessel. Dilation, more volume, increases pressure, increases filtration rate, increases filtrate production, more urine being produced. Okay, so this is a way for the tubule system to kind of talk to the cardiovascular system here and adjust filtration at the renal corpuscle. I think that is everything on the list. Is there anything that I did not cover that you saw that I overlooked? No? I don't think so. If you come up with something, get me and I'll